Welcome to the Futurist Society podcast, where we delve into the latest advancements in technology, science, and culture. From discussions on the latest breakthroughs in AI, biotechnology, and space exploration, the Futurist Society is your window into all of the awesomeness that the future holds. Get ready to be informed and inspired as we consider the positive impact of emerging technologies on humanity. Without further ado, welcome your host, Dr. Awesome.
Welcome, everybody, to the Futurist Society. My name is Dr. Awesome, and we're here with Joshua Titus, who's the CEO of Gozio Health. He is a leader in the health technology space, which is something that is near and dear to my heart because I'm also in the health technology space. But when I found Joshua Titus, I was really interested in some interesting things that he's doing because he's taking what I use on a daily basis to the next level. So without further ado, I want Josh to tell us in his own words, what is Gozio Health and how is it revolutionary?
Dr. Awesome, thank you for having me on today. You said in the intro here, we're here really just to have a conversation. And I'm genuinely looking forward to having that. So Gozio Health, fundamentally what we've done is we have cracked the code at Gozio Health to figure out how to get patients and visitors to engage with their health system on mobile, and not one or two users a day, but thousands and thousands and thousands of users a day. And so that's really what we've done. And we've done it primarily by looking at what happens in all the other fields and the other ways that we use our mobile devices, and then applying that to healthcare. So it's not pure genius. We're not sitting on the couch and scratching our chins and thinking up these amazing things. We already know what we want the phone to do. It's the same thing that it does with OpenTable or with all these other experiences that are low friction. And we're just bringing that to healthcare.
Yeah. So when you say OpenTable, when I think of OpenTable, I think, okay, I want to book a restaurant. Let's go ahead and look at OpenTable and do that. Can you do that with a physician? Because I feel like the booking of an appointment for a physician is something that is interesting, but I've just never gotten the leap to telehealth. I feel like there's a certain amount of patient interaction that I like to have with my patients in face-to-face settings. Yeah. So what are you trying to accomplish here? Is it more just like booking doctors, or are you trying to supplant the doctor-patient experience? Tell me a little bit more about that.
Yeah, it's a great question. As far as the doctor-patient experience, I think COVID and sort of the rise of telehealth to 25% of all visits and kind of waned more or less depending on sort of what specialty we're talking about. But in general, you can't beat face-to-face. That said, anyone who has ever had a routine script filled over a Zoom call is not going to want to go back. Well, that's awesome. Right? I feel great, doc. It's the same thing we've been doing. And then boom, I get that bump, that refill quickly. That's pretty nice. But if I'm not feeling well, I want to be sitting in front of you, right? I want to be face-to-face and really have that human interaction. I don't think that, let's just say it's going to be a really long time before we get around that, if we ever do. So I do think that there's absolutely a place, and we're not supplanting that human component. More so, if you think about the searching for a doctor, right? Some of the ideas that we're hearing and some of our clients are rolling out that are really interesting is, me personally, I tend to look for my doctor. I know my doctor, Dr. Foote, he's amazing. And if I don't feel well, I'm going to try to get some time on his schedule and maybe call his front desk and see if I can get some time with him, whenever that is. But some of our clients are approaching it. No, I actually want, let's take Piedmont, for example. I want a Piedmont physician to see me. I'm thinking ear, nose, and throat. If they could speak Spanish, that would be great. Near my house is awesome. And if I could do that, later this afternoon, I'd book it. And then all those avenues of care are open to me. Is it urgent care? Is it a quick care? Or is it a primary care physician? Well, primary care, 3:00 today, I'll take that slot. It's a Piedmont doc. I know they're great. And by the way, his name is, and that's almost the last step in the journey, is choosing the actual physician, right? And I wasn't sure that was going to work because that's not really how I did it. But I will tell you that the analytics that are coming back from it and the number of users who are quickly joining this platform, people want it that way. They want to feel like they have a hand in selecting the when and the where that they receive care and who they receive it from. And again, that flexibility is true. If you go to Open Table, you pick the restaurant, you pick the time that's available based on, what they're offering you. Why not do something similar with seeing a physician for something that a primary care doc could take care of, or maybe even urgent care?
Yeah, I can see the benefit of that. I would hope that we, as a medical specialty, as whatever specialty that you're in, whether you're in dentistry or podiatry or whatever it is, that we have some way to kind of establish ourselves for our own personality, because then you're kind of limited by like the location that you're in, or the amount of marketing that you're able to do. So I feel like when I look at healthcare apps that separate based on those types of factors, I worry the patients are looking like, oh, I want a doctor that's like the closest person to me.
Yes.
And it needs to accept Cigna health insurance. Right. That might not be the best doctor for them. And but then on the same token, I think that if this person has gone to medical school and they've, passed their boards and everything, like theoretically, like we should all still pretty much. I feel like, from a patient care perspective, like the access to care, it would be good. Yeah. But just from my own personal, I guess, career trajectory, I would worry that, there's no way to really distinguish yourself. I think that in the same way that dating has become a mixed bag. Some people think it's better that, people are on apps, and some people think that it's like less personal. Yeah. I worry that like we don't really know what the social changes are going to be like with that, So what have you seen like in your metrics? Have you seen any differences in like maybe patient retention? Like, are patients still seeing those same doctors on a regular basis, or are they just kind of hopping around because they can't really find somebody they like? What have you seen in the trends? Because you've been at this for like almost a decade now. Correct?
Yeah, that's exactly right. So what we see, and some of this is anecdotal as much as it is backed up by analytics, but essentially you're not wrong. The slight difference is that if you think of healthcare in general as sort of a funnel, where at the top it's very broad and low acuity. I've got, an earache. I need to go see someone, and they're going to assign some antibiotics, and I'm going to go get the script filled. And as the acuity grows and things become more serious, now you are talking about, I want the best doc I can possibly find. Right. And so it really depends on, and so the way the systems are viewing it is if I can make a very low lip to that funnel. So the entrance into my system is very, very, very low friction, easy. And close by and convenient and all those things that we get out of interaction with mobile. I've kind of got you in then. And you see that primary care guy, and he takes a look at you and says, you actually need to go see. And now there's the referral happening. You're coming down the funnel, level of acuity is going up. And then you're going to be more picky about who you go see. But likely, and this is our hope, and this is the data that we see, when you do that search for additional care, or you search for that specialist, you remain within that system. The system that originally saw you, because it was so easy and frictionless to get into it. So that's really how our clients have learned to see it. So I don't disagree with you. If you or I have a big procedure coming up, we want the best working doc we can find, right?
Yeah.
And then insurance folds into it. Sure, yes, it needs to be paid for, but we want the best care we can find.
Yeah.
But if it's something relatively minor, we want convenience.
Yeah.
And what's interesting in general, and this is zooming way out for a second, every turn we have traded quality for convenience.
Yeah.
MP3s, they're not as good as a CD. They're actually not. However, we happily switched them out. The videos that stream to your TVs, not actually as good as Blu-ray, but you know what? Sure is convenient. Right. You click on it and boom, there it is. So I think for the low acuity stuff, convenience actually trumps, the overall skill level, assuming that you meet, as you said, sort of a minimum bar of, right, I've passed my boards, I'm qualified. There may be people slightly better than I am in this particular area, but I'm good enough to get done what needs to be done to start with.
Yeah. That's an interesting concept that we've passed quality for convenience, because I do feel like, me personally, that's what I'm working on. I'm working day to day to become a higher quality surgeon, year by year, day by day. But convenience might be something that, as a macro trend, I'm going to be affected by regardless of my focus, right? So maybe, for all those physicians that are listening, that's something that they should also focus on if they're trying to build their business. I do think that there needs to be some sort of driving factor, and maybe that's just like an internal thing. Maybe that where that responsibility comes on the medical school to drive this into each physician. But I do feel like quality always needs to be a focus. But honestly, I don't think that quality and convenience are mutually exclusive. Like, one of the things I really thought was interesting about your app is just the idea that it has the geolocation. So when you I actually looked at your case study with Baptist Hospital in Jacksonville, and I actually trained in Jacksonville. So I know Baptist and I know how difficult it is to navigate like that particular hospital.
It is, yeah.
And I thought that was so genius when you had the ability to like park and it shows you the directions from the parking lot to the patient.
Exactly.
So like that is convenience, right? But I feel like that's also quality, right? Because that's a quality of experience that patient might have, that patient might not have with some, but like, even though that doctor might be equivalent to the doctor next door that does not have this app.
That's right.
I feel like that's a higher quality experience, so it's tough to draw that line. But that's one of the things I want to talk with you more in general about, because I know that you have some patents out for geolocation in general. I feel like that's such an interesting technology for the future that we've already, tapped into at a very superficial level. When is this going to be available, like in the grocery stores? Like when I have a grocery list and like it directs me to, my favorite cereal, when is it going to be available for like my assistant or like my assistants so that they know which room to go in, after one surgery is complete? Like when is that kind of geolocation technology on like the micro scale going to be available to us the same way that it is for GPS and all these other things?
Yeah, well, it's a really interesting question. I think that we are in our infancy there still. And again, our technology, it's patented. We can basically locate a device indoors with an accuracy. Last time we measured really closely, it was about 4.25 feet. So call it, round up 6 feet, 2 meters. Extremely accurate, much more accurate than GPS, especially given that GPS doesn't work indoors, right? So we can find people. And I kind of think back to, you can imagine a lab probably out in Santa Clara somewhere when they first integrated GPS into a smartphone, right? You mash these two things together and that it probably just printed out latitude, longitude on the screen. And the engineers were high-fiving, right? Job done. Look at that. It printed out this text here. Like, I can't imagine that being any cooler than this. Those folks, even though it was such an achievement, couldn't have fathomed how we use location today, right? Google, Waze, Tinder, right? The fact that I know where I am and where the people are and the things that I can do with that, and location as a filter to say, I just want to see stuff around me. And they weren't thinking about that, right? They were high-fiving because they got a blue dot in the right place.
Yeah.
We are pretty much right there right now on the indoor mapping, the indoor wayfinding thing. I can put a blue dot within 4 feet of where you are. I can do navigation. I can understand where you should go, right? I know that you can't go straight to X-ray, which by the way is called imaging, and I help you out there when you search for it, but we actually have to go to registration and then we get to go down to imaging. So I can understand sort of a level above in terms of wayfinding and navigation, but that's about it right now. And I think that likewise, the folks who couldn't imagine what you could possibly do beyond blue dot, I think we will equally be surprised at what we do over the next year and 3 years and 5 years, where your phone knows a lot about what's around you in a way that brings context into it and can make a really personalized recommendations or give you advice. Imagine the stuff that's going on with Chat GPT now combined with location information. And it was basically, your Brainiac tour guide that's with you, if that's what you wanted. I think there's just a ton of stuff that we're going to be able to do in this space. Mobile in general, I think, is going to continue to grow towards more and more personalization. Something as simple as Spotify, the fact that when I launch it, it plays songs that I like and then says, by the way, Josh, other people who like the stuff that you're playing also like these. Maybe you would like those. And that's a pretty cool way to do recommendations, right? So you take those kind of good ideas and you fold them in towards personalization. And I think that happens across the mobile spectrum. And then you move into healthcare, which is just now really beginning to adopt mobile as a proper interface to our healthcare experience. And that is ripe for personalization as well. And maybe even more so than some of these other pieces. So we're really excited about that. You ask, when will it come to the grocery stores? When will it come to the sports stadiums? And to be honest with you, it could have, if we had focused on that. But our heart is in healthcare, and we feel like that's where the most acute pain is. And we think that we can solve that directly. And as much as it may be lucrative as a company for us to, tell you there's a half price latte every time you walk past a Starbucks, we're just not interested in that. Yeah. Our heart's not in it. And would it be awesome in the grocery store? It would. There are several times that I've been in a grocery store. I wish I had it. But by and large, we feel like with the engineering talent that we have to focus our abilities to helping people who are likely having a pretty crappy day otherwise, or worried about a clinical outcome of the day, or for a loved one, you have a kid, you're going to a children's hospital. If we can make that day a little bit better through our engineering effort, then that's where we should be spending it. And that's where we focus. So nothing stopping a grocery store from doing it. But again, we're focused on healthcare right now.
So specifically in regards to healthcare, I feel like the majority of technological innovation, I feel like right now is focused on the either electronic medical record component, the interaction of a patient with that, or, making patient's experience more accessible, similar to what you're doing. Yeah. Or you have this like very focused cutting edge technology for very specific things. Like if you have like a surgery that is very complicated, you add artificial intelligence or augmented reality to that to make it like safer or something like that, But then I feel like there's a lot of like low hanging fruit that I just don't really see a lot of innovation in. Like, for example, like sensor technology, right? Like on my Apple Watch, it takes my heart rate, it takes my, movements, takes all of that stuff. I don't really see a lot of integration. And maybe that's just because I'm not looking, but as someone who's a little bit more in the industry, like how much of like that type of sensor technology is now being incorporated into healthcare?
What we see that I think is interesting is a lot of times when we meet with clients or prospects, even more importantly, and they're not client yet, they have these huge dreams. When I pull up, Josh, I'm going to greet you and welcome you to the building and tell you you're already registered, and you go hang out in the healing garden until it's time to be seen. And they have these big dreams, and we're like, that's awesome. It sounds like a great experience. Can you do any of that? And they're like, no, we can't do any of that. Can I grab some time on my doctor's calendar? No, we're still working on that piece. And so in other words, we're still screwing up the easy stuff.
Yeah, that's so.
So then what it comes down to is, what can that hospital system actually operationalize on their side? Technology we can bring in, but can you actually operationalize it? So then shifting and thinking about the IoT and the wearables and that sort of thing. Like I said, your watch has incredibly rich data about you, how you're doing, how you're sleeping, right? All this really rich data. To pipe that over into the hospital from a technology standpoint is a piece of cake. It's what do you do with it then? Who's actually going to look at this stuff, right? If I package this up and I mailed a gigabyte file to my primary care physician, he's going to write nerd on my chart, right, and keep moving. So it's what can we operationalize on the hospital side that really drives the adoption? The technology is there and being used elsewhere, but what can we operationalize? So that's the piece that needs to be solved. What are we going to actually do with this data? Where does it live? Does it live inside your EHR? Is it a separate data lake that everyone can poke into who needs it? Like, what does that look like? Where does it live? And who has access to it? That's the hard part. The easy part's the tech.
Yeah. And that's where I think that the big hope is for AI, right? Is to sift through all this data, because humans just don't have the ability to devote the time necessary for that. Is that correct?
I totally agree. Yeah. If you think about it, if I say Dr. Foote, I mentioned him earlier, can you spend an hour and a half sifting through all this raw data I just dumped on you and let me know if I look okay, right? And He'd say, I can do it, Josh. It's going to be $1,000.
Right.
Well, I'm not going to do that. Right. But if he said, hey, I got 2 flags out of that data that you sent in, and I zoomed in on them. And yeah, it looks like something's going on early morning. So why don't you come in and see me and we'll do A, B, and C. That's how it should work. Right. So again, how do you want to process this data? Who handles it? Whose job is it to handle it? Who has access to it? These are all excellent questions, but yeah, nothing we're focused on necessarily at Gozio, but I share your interest in how that plays out, because I think it is a key component in how we change to adopt, being able to adopt and put to use some of these newer technologies that are bubbling up right now.
Yeah. I think that I hope that we do use that more significantly in the future, because I feel like right now, as an industry, we're not so much healthcare as we are sick care, which is, this term that everybody uses, but it's accurate, right? I mean, we're very reactive to problems. Like, we're only addressing them when patients actually have symptoms. But the idea of anticipating disease is only going to happen when we have those vast amount of data and have the ability to track things and longitudinalize projected outcomes from it.
Right.
And we just never had the manpower before, right? And so, like at MIT, let me give you an example. Like, they have this study. I live in Cambridge, Massachusetts. So they have this study. So they created this this device, like almost like a necklace that they wear, and through the Wi-Fi, they're able to tell location based on inches. And so for Parkinson's patients, they have the ability to monitor their movement. So if their movement is more erratic, they know that they need to up their meds. If it's more erratic at certain times, they can tailor their meds to give them a more equal metabolism, so that the meds affect them on a more consistent basis. And that's where I feel like the future is, right? Like, that's something that, especially for primary care, like for managing these kind of chronic diseases, that's something that I think would be really interesting. But it's just like what you're saying, there's so much left to do with the stupid stuff, right? Like,
there is, yes. Exactly.
I can't tell you how many patients on a regular basis call me because they get lost in the parking lot. Like that. When I read that about your guys' company, I was like, oh my God, that's genius. Because that is such low hanging fruit, like that's something that we needed to fix 10 years ago. But we still haven't.
Well, and I'll tell you that, when we ask our clients, our platform does a whole bunch of things. You plug in wait times and physician databases and your EHR, all that plugs in. But the wayfinding component, when I ask the UNCs and the Yales and the Prismas of the world, what is the value of my platform to you guys, of pulling together all these disparate data sources and making them available, or the wayfinding, kind of the hand-holding component? And the number comes back, and it's always within a couple of percentage points, but roughly 25% of the value of the overall platform is still that hand-holding component, right? That wayfinding piece. It's a big part of it. It's a big stressor when again, if a nurse of 20 years says, Dr. Awesome, I'm going to jump in with you for this next visit to the big hospital downtown. I used to work there. I know everything there is to know about it. Let's go. I'm going to show you where to park. I'm going to remember where you park. I'm going to take you in and help you navigate this. Your stress level just dropped by 30% at least, right? You're still worried about the clinical outcome. Don't get me wrong. However, you're not worried about finding your car when you come back out. You're not worried about being late because you parked in the south deck, not the north deck. All these type of things just fall away from you. So even though it is simple, that hand-holding and wayfinding component is 25% of a visit. So we do. I mean,
I don't think it's simple. I don't think that it's a solution. It's an elegant solution to a problem that I don't think that anybody has really identified before. I mean, every single large hospital system is difficult to navigate. I mean, if you go to an academic medical institution like Tufts University, right, where I work, just me as a faculty member takes me about 20 minutes to get from the parking lot to the clinic where I work. So I have to park, I have to take this elevator, then I have to go down this wing, and then I have to go on this other elevator. And most of it is because the majority of hospital systems were just built by piecemeal.
They grew organically over time.
Exactly. So they're not well thought out. And I even if you have the best advantages like I do, where I have like a faculty parking pass and like I have a badge that gets me through all of these like places where you can't badge through.
Yeah.
I even have difficulty. I can't even imagine like how difficult it is for patients. And that barrier to entry, like if I was a patient, I wouldn't want to go there. I would want to make sure that I go to a clinic that I could have easy parking and like walk right up,
Yeah. Well, and Dr. Awesome, you're doing this and you're not that stressed, right? Your 157 IQ isn't 97 that day because you're worried about the outcome and the wad of papers that your primary care guy handed you and said, make sure you bring this with you to the, like, you've got so much going on in your head, let alone navigating.
Yeah. Yeah.
So that makes it even more difficult than what you're experiencing, but you're absolutely right. And we would consider to be a power user. You're there 3-4 days a week. Whereas patients and visitors, we tell ourselves this all the time. We don't have power users, right? They're going to use our app 6 to 9 times, probably. They're likely in this building for the first or second time in their lives. And we have to make this easy and accessible and intuitive. So that's a challenge for us, but it's also something that we're up for and we enjoy.
So I'm going to ask you to take off your healthcare hat for a second. Sure. And then I know you used to work for NVIDIA, which, is, I'm a big gamer myself. And so, NVIDIA graphic cards are kind of like the gold standard when it comes to gaming.
Yeah, they are.
I just want to talk about processing power, just like in general, right?
Sure.
Like,
yeah.
Obviously we're on this exponential growth curve. Like how much processing power is necessary for like photorealistic experience, like the way that we're talking to each other right now,
right?
Part of that is based on the engine that you create, right? Which is like the most significant engine out there right now is the Unreal Engine, which is
exactly.
It's close, but it's still not quite there. Right? It gets close. Like how much processing power is required for there? Like when, like, can you give me a timeline of like when I will be able to experience a virtual setting very similar, at least from a visual perspective, similar to like what we're experiencing right now?
I think we're really, really close on that piece. Once you're able to enable ray tracing, which mimics light itself, and you get all the things that come along with that in terms of how smoke actually works, how reflections and refractions work, and you're just modeling that, you're going to be there. So you can certainly get in. There's demos today that I think you would have a hard time other than sort of this uncanny part where that didn't move like a human moves. That's just a little off. But as far as how it looks, it could completely fool you today. Now it's just a matter of getting the frame rate up for that type of thing. Honestly, I wouldn't be surprised if the next generation is able to do it. So 3 years, something like that, I think will be where you'll have a hard time telling what was rendered on the fly and what wasn't. And the way that we got there was really by learning how to do things in parallel and massively parallel. And so to do things like, the old analogy that we used to talk about is you have a delivery service. You can keep souping up that delivery truck and you've got the biggest engine you can find in it and it'll do 90 miles an hour right off the red light, or you can just buy another truck.
Yeah.
So it's much better to have parallel pipelines, 512 pipelines, whatever we are today, and break the image up and do it in parallel. And so being able to do massive numbers of things, thousands of things at once, and then combine them at the end was the real key and the breakthrough for getting to photorealistic rendering and doing it quick enough to when you get into the 30 to 60 frames a second rate, you're now into gaming territory, as long as you keep the latency down. So there's that piece. So going in parallel is really key. It turns out that exact same approach is exactly what you need to train neural networks for AI.
Yeah.
So the reason that the GPUs are used is, actually a friend of mine came up with CUDA, and it takes things that would have done one at a time in past years, realizes that no, if you turn that sideways and look at it, you could actually break this into multiple parallel things. And instead of one at a time, you do 512 at a time. Well, suddenly you're cooking, right? And so that idea for being able to train these models and then have them execute more quickly is why NVIDIA, as we're talking about, is still a major player in, full self-driving and and training AI models and computer vision. They're big players there because of what they developed for the graphics chip. And they found that it actually had just a side benefit of being really good for AI. And of course, they ran with it once they discovered that. But it is interesting how it's the pretty clear path forward is doing parallel.
Yeah. I think parallel thinking is something that organically in the brain is what's happening. And that's why they say like a lot of like, AI is gaining a lot of insight from these, what is it called? Neuron-based models or
there's deep learning, there's neural nets, there's those type of things. Neural nets,
that's
which does its best to mimic the, how the brain learns and does pattern matching and that sort of thing.
So those types of calculations, so first off, the reason why I wanted to talk about the visualization is because from a layperson's perspective, I feel like that's what I think is like the highest amount of computing power, right? Like when you're recreating something like that, you're recreating an environment. I think like that takes like a lot of calculations. It takes like a lot of like computing power. But is the transition the same when you're talking about like geolocation, or is the computing power the same, or is it just different because you have just like a ton of users? Like is like the reason why I ask, right?
Yep.
Is because what I would love to know is, okay, we have all of these advances in computing power solely for entertainment purposes, right?
Mm-hmm. Yep.
Is that going to be an easy transition for computing power for making EMR work better? Is that going to be an easy transition for, people to have, better CT scans? Like, is it a one-to-one thing, or is it just like totally different things that we're talking about?
So I think the key to making those things better is really the introduction of AI and filtering, so that by the time a human looks at it, it's, all the clearly wrong answers have been removed. And now I can get down to the core of what I need to look at. And so I think that the compute power will be used to quickly train those models. And then you can have a really complex model is if you have a powerful engine to make use of it, right? So I think that's going to happen. The other thing to keep in mind though, Dr. Awesome, is that when you increase the compute power, that allows you to do more things with a certain amount of power, check. But it also allows you to do the same thing you used to do at lower power, which means that now maybe this slides into and lives on a mobile device.
Right.
So you might have to have a desktop to run the MRI, processing power that you need today to visualize, to spot certain tumors or whatnot. Well, maybe that happens on your smartphone in 10 years, right? So same thing we're doing today, but with a lot lower power, because a lot more muscle, so to speak.
Gotcha.
Yeah.
Okay. That's interesting. Okay. So does AI require more computing power than like something like that? There's like renderings and stuff like that? Or is it just like you're saying, like the algorithm becomes more elegant and then the computing power comes down?
In general, training the models that are used by AI is incredibly power intensive. In other words, you'll notice if you think about the Bitcoin mining, it's a kind of similar thing to that, where literally people will build these farms in Iceland because they're going to be powered by cheap geothermal, because that actually makes monetary sense. The amount of power that you're pulling can be, it's measured in like thousands of homes to train an AI model.
Wow.
Like the annual power requirements for a neighborhood would be used to train a model for a week or something like that, right? So incredibly power intensive. Now, once you understand the model and you have the model created, you can use the model with much less power out of it. But the initial creation of it and the training of the model is incredibly power intensive today.
Yeah. So, right now, AI aside, like we're sifting through data, just on a regular basis? Like, I mean, you're probably sifting through tons of data for your own program,
Yep.
So like, are you doing the majority of this just, with computing power that's just available to you, like on your desktop, or like you outsourcing this to, like Amazon Web Services? Like, how are you sifting through your own data? Like, I feel like AI is not, ubiquitously available. It's just still something like we're talking about right now, right?
Well, we use, pretty much anytime you need heavy duty compute power today, it's going to be, it's not going to be what we call on premises or on-prem would be the nerd speak in years gone by. Everything's cloud-based now. So it's just how much of, Amazon compute power do you want to buy? And then you have that crunch on your model for you. So it's fundamentally outsourced to other people's machines that are cloud-based.
Yeah. So like, what are you looking at in your own data, like your own healthcare data, like some of the things that, other than like the user experience for like making sure that your business gets better, like what are some novel insights that people that are listening to this might want to know about from just like the massive amounts of healthcare data that you were able to sift through? Because I feel like, having millions of users that are, going to a doctor on like a regular basis, you probably have insight that I or any of my colleagues might not have.
We are just beginning to really dig into that to get the second and third and fourth order effects that are in the data. We get about 15 million interactions a month right now, and that's plenty to have some insight. A lot of it is driven by what our clients want to know, right? And the first thing they want to know is anyone using this damn thing. So it's a real simple number. How many installed users do I have, right?
Yeah.
Okay, cool. How many do I have using it a day? All right, fine. It's that kind of thing, right?
Right.
But somewhere around between the first and the second year, especially if we can connect with their business intelligence team, you start looking at things like, all right, there's really low level data that you could look at. Like, Josh, where is everyone searching for parking while they're standing in your building? That's where my parking sign should go. All right, kind of neat. But let's zoom out a level. Josh, where's everyone in the Atlanta metro area standing when they search for urgent care? Big red spot up here on the heat map next to Johns Creek. That's where urgent care is going next. So now we're making operational decisions, right? We're making these larger operational decisions. And where we want to go is to move that data into more predictive analytics. Like, we don't know why, but we've had a 20% jump in people looking for urgent care today. Your ERs are going to get hammered in 12 hours. So heads up, you better get staffing rolling. And this is what's going to happen. So you can look at sort of macro trends and let the hospital system know what to expect. Or you can look at personalized trends of people who did this, then this, often expected to do this next. And so that's what's presented to them on their dashboard. Like, we think you're likely going to want to do one of these, 2 or 3 next things. And it just feels like the sensation that the user will have is, the system gets me, right? Here I am. It's time for me to go back to my car. I finished up my visit, and look at that right on the top. You ready to go back to your car? Yes, I am. But that feels very personalized and cool, but it's all driven by analytics of what other people did, right? So you can do lookalikes, and all these things that we use in other fields can apply to the visit and the experience of the patient while they're on site and while they're offsite at home. So we're excited about those pieces, but just now getting into those second and third degree of insight based on the data we have.
That's cool. I think that one of the things that I look forward to is when you guys can communicate with like all of the EMR, and we can learn about macro trends, like where the healthcare deserts are, where what are people searching for? Like, let's say if like a new pandemic breaks out and all the symptoms are coming up, like the way that Google was used as a resource because people were searching about, particular symptoms with coronavirus and things like that. Because I feel like, the era of big data is here, but I just feel like we don't know what to do with the data. Like that's something that I really look forward to in the future.
Yeah.
But it's also something scary, right? Like, and that's what I want to put like an optimistic spin on it, because that's one of the things that I want to do with this podcast is make sure that when people think about the future, they think about it in a positive light. But many people would be hesitant to think that all of these, interactions and all these data collection pieces are a good thing. They worry that this is going to be used in a negative fashion. So what would you say to those people? Because, On the one hand, it might make for a more convenient life, like we've
Yes.
talked about. But on the same token, it almost lends itself to being less freedom, like more directed by these large entities. You know what
Yeah.
I'm saying?
Well, we talked about macro trends earlier, and the one that we chatted about was that people have historically traded quality for convenience. The other thing they traded is privacy. Yeah. No, I don't agree with it. I'm not on social media. Like I tend to be a very private person. But if you talk to my daughter's generation, certainly privacy is way down on the list as long as it's convenient and fun, right? So I think that there's a general shift away from maybe the way that you and I think, and again, I'm not going to claim that's a good thing, but it is real. And I also think that there's ways that you can do and treat privacy that keeps it relatively compartmentalized. So for instance, just an example of how we've approached it. When you have an appointment reminder, or let's say you're using a EHR, and we'll say it's an Epic EHR, you're in my chart. My chart can say to Gozio, to my company, take the holder of this phone to this department. And we will merrily take that phone and navigate it to an infusion appointment. We don't know who you are, though, right? I don't need to know. Epic may know who you are. We don't want to know. So by sort of keeping data that we would consider to be PHI behind the authenticator firewall and doing everything else we can possibly do outside of that, then let's do it that way. And that is one reason and one of our secret sauces in terms of driving lots of users. If I had you authenticate as soon as you logged into, or as soon as you open the app, that's how you get uninstalled instantly. Right. Yeah. So let's do everything else that we can do. The things that are more private or should be more private are often more private. Let's have those behind your authenticated piece and keep them somewhat separate, and be very clear that we're keeping them separate. Right. We've had clients in the past who thought about sort of combining these things and being able to use pulling in like a Salesforce style, I know everything about this person, and pulling it all into this 360 view of the individual. But that's pretty creepy. And if the story were written, not that this hospital system really wants to embrace you and give you the best possible experience, but this hospital system tracks you, that's really bad. Like, good luck getting that stink to wash off, right? That's not going to be easy. So I think the privacy thing is real, especially at the intersection of technology and medical privacy, which is near and dear to our hearts, right? This is something that's very, very personal. I have to go through chemo. That's a very, very personal thing. And I think it's best to keep that compartmentalized for people today. Despite the trends towards being less private, I think healthcare may be an exception to that rule.
So, I hear what you're saying, and I want to look at the idea of privacy. Mm-hmm. When we're talking about people are giving it up, is it as big of a problem? Let's say, God forbid, if someone like myself, my electronic medical information gets out there, right? How bad is it, for those people, when people think about, the idea of giving up their privacy versus, having this information out there, what is so bad about it? Just explain that to people who might not understand that.
I've seen demos where there's companies that wanted to work with us, and they were showing off their technology. And they said, Josh, we can combine together and we'll have this amazing view of people. And I said, well, give me an example. They said, well, you know what driveway people leave from when they come into the hospital, right? I said, we do. Yeah. He's like, all right, so give me an address. So literally we opened up a Google Maps and I spun it to a house and clicked on it. Up pops the address. He opens his laptop, types in the address. All right, you got a dad and a mom. They got 3 kids. The dad's suffering from this. The wife's suffering from this. We have this much left on their mortgage. Their kids go to this school. They like to boat. They've got a boat and 2 cars. Like they know everything about you based on just your address. You start folding in detailed medical information, and that view of you is, they may know you better than you know yourself.
Yeah.
And for me, at least, that gives me the heebie-jeebies. I don't want that just out there as a model for anyone they want to sell it to, right? Anyone who wants to market to me, or anyone who wants to not sell me insurance because I've have a certain lifestyle or whatever it is, right? And maybe I'm showing my age here, but I just think there should be a certain degree of privacy, especially when those things all come together into an absolutely complete picture of an individual. That's scary to me.
Yeah. I feel like we're getting a little negative, and I want to make sure that people
well, it's a cautionary tale. Let's say. So
it's definitely a cautionary tale. I think it can be used for good though. Like just to put a positive spin on it, when I think about, like my Apple Watch telling me, okay, like, dude, you need to stand, right? Like, you need to do something. I hope that there's some sort of beneficence that's associated, especially in the healthcare industry, that says, okay, rather than, like, I see that you're at McDonald's right now. Is this a good decision for you, Imran? Like, I don't think that this is something that would be so terrible. But on the same token, I see what you're saying. I hope that we can gain more benefit than detriment from the era of big data. I think
I think we can. Let me give an example of something that we're working on where we kind of blend the privacy, where we're there's an exchange that takes place where you tell me a little bit about you. And because of that, I'm going to be able to give you a much better experience. So you open up the mobile app for your favorite hospital and you self-declare, I'm here for labor and delivery. All right. Now that I know you're here for labor and delivery, you probably want a different color scheme. The educational content that I want to present to you is different. I want to let you know that we actually have firefighters who will come verify that your car seat is installed correctly before you leave with your baby. You're going to need that. And by the way, there's 25% off Babies R Us, right? In other words, wow, this is an awesome experience that you don't know who I am yet, but I've told you a little bit about me and sort of why I'm here. And contrast that with someone who's there for end of life, or if I'm an oncology patient coming back as a frequent flyer, getting my infusions, it's going to be a little bit different experience, a little more somber. I don't want to see ads and, the cheery stuff and the bright color scheme. Maybe we go a little more neutral on that, right? So we can customize and give these personalized experiences, even though I don't know who you are. You've told me a little bit about you, and based on that, I can take you and get you 90% of the value of knowing who you are. So I think those are the trade-offs that we're seeing. So we went a little negative earlier. It's what happens if we go to 100% to the left? You tell me a little bit, I can do a lot with it. And I think that's where we'll end up.
Yeah. I really hope that tailored experience is something that happens, when my wife became pregnant, we started getting, a lot of these baby ads in the mail and things for like formula and stuff like that. I appreciated that. I thought that was, I don't know how it happened. I know that it did happen. But the fact of the matter is that I appreciated the fact that I was getting all this stuff because it's not a field of that I was interested in before we had the baby, And so when we're talking about a tailored experience, I look at that as like a positive spin on the future, 100%. Right? And even when, I buy something on Amazon and it makes me interested in other things, I don't think that's a bad thing. The goal is for Amazon to sell more product. I get that. But on the same token, sometimes it's nice to know that this is something that I didn't know that was out there that I would appreciate. So I look at that as a benefit. There is a lot of detriment to having your all of this information available. If people wanted to do bad stuff with it, I think that that is out there. But I do think that there's a lot of good. I do believe in the free market. And I do think that it does tend to bring out the best in society. And I look at the way that I'm living now, and it's hella more convenient. I love the fact that I can have something delivered, today. Next day. Today with Amazon. I don't look at that as a bad thing. It's very easy to spin it as a bad thing, but I personally don't see it as a bad thing. I think that there's always this nostalgic viewpoint from the past about how everything was better. And it's a very common philosophy to say that things are becoming worse, but I think in general, they are becoming better. And, one of the biggest components is that I have to deal with on a daily basis is just the electronic medical records, and there's so many people that come in and just have this different idea of what is possible. Like there, I can't tell you how many people come in and tell me like they don't have their medical information, they don't have anything with them, and they're like, "Oh, it's all on the computer," as if my computer is linked with like every other computer that's out there.
Right.
So I appreciate the fact that you have like a mobile platform like yourself where they can just pull it up on their phone. I can see all their labs without having to call this, that, and the other person.
Exactly.
You know?
Yeah.
So I look at that as a benefit. I think that's something that it's certainly more convenient, but it does provide for a more quality experience.
Agreed. Yeah, completely agree with that.
Well, Josh, we're coming to the end of our time right now. I just want to thank you for coming on the Futurist Society. I do want to leave with just one thing, which is something that I always leave every guest with, is when you think about the future, like, what are you most excited about? Like when you're thinking like, man, like that's an exciting technology that's coming out, and I can't wait for that to happen. What is that sparks it for you?
You know, this answer is not going to light your hair on fire, but it is the part that I'm actually excited about. And you know, it's not the exponential change in technology necessarily, but for healthcare specifically, it's the exponential adoption and the adaptation of what we're doing everywhere else. From the experience I have on Delta, right, where I'm on the run, everything's on my phone, I get my seat upgraded, I know it. They changed the game. That entire experience is so nice. But to take the cherry pick, the things that we love in technology from all other aspects of our life, and watching those get adopted and applied to healthcare, that's what actually delights me. I really enjoy seeing that happen. And quite honestly, you already have the proof of concept out there. We're already doing these things everywhere else. So it's not surprising when you bring that into healthcare and people are, blown away that we can do this. So I am happy to see where I used to be out there. You said, I've been in this thing for a decade, evangelizing the need for this. Whereas now my phone rings and it's, Josh, we want to go do this. How can you help us do it? Right. There's this drive behind it. What is desired from the market is well understood now. We've been trained on all these other apps. Just how do we bring that into the healthcare setting so that it's most impactful? That's what I'm excited about. And really, that's what inoculates me against the day-to-day grind of running a technology company, is seeing other people use it and be delighted when they're like, oh, I didn't even know this was possible to do in a hospital. This is amazing. Yeah, no, I think that's a very astute point. Like when I think about just like Web 1.0, where I had like a GeoCities website, which was like just text only. And now everything is on our phone, and we have like this, interesting interaction with technology that makes our life, I think, more convenient for sure, but also, more easy and more livable. I think that's something that I'm really excited about also. Thank you so much, Josh. So nice to meet you. And hopefully we'll talk soon. Okay. Very nice to meet you. Thank you for having me on. Anytime.
We appreciate you taking part in today's episode. Take this chance to reimagine a better future by joining a community of futurists who strive for a remarkable world. Be a part of this growing network and contribute to making the world a more positive place. Visit thefuturistsociety.net and subscribe to the show so you don't miss a drop of hopeful futurism.